bladder. So you may have technologists doing their upright post-void KUBs at a distance of maybe 60 instead of 40, because we're trying to decrease what? Magnification, getting the entire system in there. So it may be done that way. All right, so you guys can look at that. What are you missing?
The white box.
Oh, it's the same thing as the other one. I just copied and put it on there. This is on your previous. You have a picture like this on the previous slide. This is the same one. I just put it in here. All right. Hypertensive IVU. Remember, we said this is also an indication to do an IVU if someone is hypertensive, which is might be an indicator that the renal artery might be obstructed. If it's obstructive, it causes high blood pressure, and so they'll do a test like this. So a hypertensive IVU, it's a little bit different. There's a slight nuance to this. So remember, we were talking about the normal one where you did 1, 3, 5 up here. In a hypertensive, we do one every minute. We'll do a 1, 2, 3 back to back. Okay, we'll do it consecutively, 1, 2, and 3. Okay? So the radiographs are taken every minute up to 5 minutes. So that means maybe 5 in total of just up here. And again, we have to time them because we're trying to evaluate how quickly or how slowly those kidneys fill up. Okay, you guys with me? So if there is renal artery stenosis, the contrast media is slower into one kidney than the other, one due to the blockage or narrowing of the renal artery. So all hypertensive means is that we're taking extra nephrograms or nephrotomograms. So instead of doing 3, we'll do 5, 1 every minute. Make sense? Okay, so that's your hypertensive IVU. All right, we're almost done here. Retrograde urogram, done in the OR. That's a special table that's designed to perform this procedure. So you may be going in here, placing an image receptor. So this is a specially designed X-ray rooms to do these procedures in the OR. Patient is in a lithotomy position, and this is where they put the catheter in and do a retrograde study of the kidneys. So patient has to be knocked out because that's painful trying to get that catheter up in there, okay? All right, any questions? Keep on going. Retrograde cystogram. Someone said they saw a cystogram or a VCUG, okay? This is just a plain cystogram, okay, not a VCUG. So a cystogram, we're gonna put a urinary catheter into the bladder, okay? And we're going to fill up the bladder with contrast using gravity. Now this is an important note. Right here. It's a non-functional study of the bladder. So a cystogram, a retrograde cystogram, is just simply to look at the size and the shape of the bladder. It has nothing to do with function. So it's a non-functional study. The retrograde cystogram is done for trauma, stones, and also inflammatory disease. All right. Then we just take the pictures. Oh, sorry. Oh, up there. Okay. So then we just now take the pictures in various positions, and they're very simple. It's mostly an AP, a straight AP, or maybe an AP with an angle. Can I get one going? Yes. Okay. Maybe a straight AP, or with this modification here where it's an AP with 10 to 15 degrees caudal. What are we trying to do here? It has nothing to do with the bladder. It has more to do with the symphysis pubis. So this angulation is going to throw the symphysis pubis out of the way. Okay, so this angulation throws the symphysis pubis out of the way for better demonstration of the bladder. So AP, 10 to 15 degrees caudally. Do we need a large image receptor? Do we need a large imaging field? So only collimate to the area of interest. Okay. Then you have your additional views, which is your oblique and lateral cystograms. And the additional views are to look for obstructions. Remember the UV junction? It says here that you want to rotate your patient anywhere between 45 to 60 degrees. Steeper angles are good to visualize the UVJ. I don't think that's on your slides. Okay, so steeper angles will better demonstrate the UVJ. And again, column it to the area of interest. We don't need a large field. Okay. And then a lateral. Optional projection, we can also do this. You guys can look at this at your own. I'm not going to spend too much time on that. Okay, so AP. The urinary bladder is not superimposed. This is why we do the angulation to throw the symphysis pubis out of the way. So in a posterior oblique, the urinary bladder is not superimposed by the lower limbs, and the distal ureter bladder and proximal urethra on the male must be included. So again, if you're doing a male, you're not only looking at the bladder, but you also want to look at the urethra. Okay, not just the bladder, but you also want to see the urethra. Anything wrong with this image?
It's clipped.
Okay, it's clipped, so that's not a good shot. All right. Voiding cystogram. So once the bladder is filled up, now this is the functional part of the study. We're going to have the patient void. So the purpose of a voiding cystourethrogram, or a VCUG, is a functional study of the bladder and urethra performed after the routine cystogram, after the catheter has been removed. We do images while the patient is voiding. Okay, so the patient may be voiding through a receptacle or maybe a bunch of towels. Okay. Females are usually done in an AP projection, whereas males, they have to be done in an oblique. Okay, they have to be done in an oblique because of their urethra. And so females are done AP, supine or erect. Males are going to be done in RPO. Okay, we're going to lay the penis over the femur and use that as a backdrop because we want to see the entire urethra. Okay, and then last but not least, Aquaman. That's his trident. Brody clamp, right? So it takes, okay. So the clamp,
Yeah.
I don't even know if I want to describe this, but
It's the claw.
it's a claw. So yeah, it grabs the head of the penis, and then you have this tube that's inserted into the urethra.
I am not
And
down
then at
with
the
it.
end here is, well, they will inject the contrast or drip or infuse the contrast into the urethra. So again, rarely performed.
Nope.
Only if you've been bad.
You're gonna get a bigger Brody clamp than that, bro.
TMI, Nick, TMI.
Oh, you only
Got
got.
the ladies giggling, but the guys were like, yeah, whatever.
Hey, that's 14 by 17, big
Right?
guy.
All right, guys. So you guys can look at the rest of the images that were posted.
Yay.
Here, okay. We're done. So